Here are a couple of things I tell my patients not to do after they've had their C-section. 1, nothing in the vagina. It's important to remember that you just had major abdominal surgery. And so there's a connection between your uterus and your cervix is probably open. And there's an open wound on the inside. And so you want to allow that wound to heal. So for improved healing and to decrease any risk of infection, we usually recommend nothing in the vagina until your doctor tells you so. 2, no heavy lifting. That means you should not be lifting anything that's heavier than your baby. Sometimes we even say nothing heavier than 10 pounds. I know, it's crazy. But the reason behind that is because, again, you just had major surgery. You want your incision to heal well. From inside of the uterus to the layers of your abdominal wall, you want all of that to heal well. So lifting things that are very heavy will increase the pressure inside of your belly and can cause premature opening or strain on your scar, and your incision may start to open, which is not good. You're not going to feel good about it. And also it may lead to more pain and bleeding, and we do not want that to happen. Avoid baths, douching, hot tubs. Again, you don't want any stagnant water going into your vagina, and that's going to create more infection, and we do not want. Now, traditionally, we send our patients home with narcotic pain medication. And so if you're taking narcotic pain medication, we often recommend that you do not drive. These medications can sometimes cause drowsiness. And if you're just recovering from a C-section, you don't necessarily have the greatest strength. So you need to be able to slam on the brakes really quickly. Your reflexes need to be fast. And if you're not able to do that because you're on narcotic medication and because you're not appropriately healed, it is best for you to just be a passenger and just let someone drive you. I encourage my patients to walk as much as they can. I usually say take about a couple of 5-minute walks every single day and increase it as you tolerate. You can go up and down stairs, but no running, no huge marathons until you're cleared by your doctor. Again, walking helps with constipation. It helps you pass gas. It helps your bowels move, which help decrease your pain. It also helps prevent blood clots because, again, you're still at a high risk of having blood clots in the postpartum period. I hope this was helpful. I'll see you in our next video.